Michael, 90% of our clients, right when we first meet them for the first time, they ask us the question, do I do a Medicare Advantage plan or do I go with a Medicare Supplement Plan? And they want to know the difference. When you ask people on the street, hey, what do you think? You know, friends, family, aunts, uncles, they're going to have an opinion. And it's typically whatever they're on is what they think is the best option, right? So what we do, you and I, obviously, we help guide each person to the right plan because it's not a one-size-fits-all. So what today we're going to go through is the pros and the cons of a Medicare Advantage plan and the pros and the cons of a Medicare Supplement Plan. And that way we can educate the client to where they say, you know what, I know what I want to do. By the time we're done educating them, they usually have a pretty darn good idea which way they're leaning, right?
Yeah, well, that's the point. I mean, the fact is that not everybody has the same needs, different lifestyle. Some travel a lot, some don't. Some have, multiple homes. So I think, our job is to point out, like you said, the differences and kind of fit them into the direction that best fits their needs and kind of what they expect out of their Medicare.
Right. So I'm going to just kick it off with the Medicare Advantage. That's something that's grown quite a bit since 2013. Enrollments have doubled. From 2013 to 2025, that's a pretty huge deal. So I'm sure a lot of folks are like, what's the hype about? Why would I go with this Medicare Advantage? So the pros that we've kind of come up with, and we have this discussion every single time we meet somebody, is it's an all-in-one plan. And I think people like that. I know for myself, I've got a Medicare or a medical card for my health insurance. I've got a dental card. I've got a vision card. Got all these different cards, and it gets a little confused. It's a lot to keep up with. And the Advantage plans these days, they keep everything kind of compact, all in one, all on the same card. It's just easy, and people like easy. They don't like having to keep up with things, especially the older you get. You want your life to be a little bit more simple. The low monthly cost. Most Advantage plans that we deal with, and really around the country, they're started at $0 premium, most of them, and they go up a little bit, but usually they're very, very affordable.
Yeah. The national average, just I happened to read this morning, is $18. National average. So obviously we're in a market that has zero, but we also have a market close to here that's 21. So I think if you look nationwide, they're coming up with that $18 average, which is affordable in anybody's.
Yeah, no doubt. And just to be clear, that's in addition to whatever you're paying for your Medicare Part B premium and any income-related adjustments or late enrollment penalties. So that premium that we're talking about for the Advantage plan, that's in addition to the premiums you're already having to pay by law. Another advantage that people like is before they have a service done, they kind of know what they're going to pay. There's co-payments on there, so it's not 100% predictable, but if you go to the specialist, you know you're going to pay a specialist co-payment. If we have x-rays done, some plans don't charge, some do. So there's kind of a guide on, hey, if I do this service, this is what I'm going to pay. And I think people like that. They can kind of predict before the year begins what their out-of-pocket costs are going to look like. What do you think?
Yeah, I mean, look, I routinely have people will call me and say, hey, I'm having an MRI. What's it going to cost me? Well, we covered that when we enrolled them. They have a plan book, but they just want a fact check. And it's easy for us to kind of regurgitate the information and say, oh, that'll cost you $250. Okay, good. That's all I wanted to know. They just want to know, what can I expect when I get to the doctor's office or the clinic? What is it going to cost me to have this service done? Not that they're planning on putting it off. They want to know. They want to know, what am I going to pay for that service?
Let me ask you a personal question. You're on an Advantage plan.
Right.
What do you like best about yours?
Well, again, it's the predictability of the cost. I'm okay with it. But what drove me, I did start off on a supplement. Honestly. And, I looked at I did cost comparison and kind of looked at how often I went to the doctor, but I started looking at what was most important to me and just being simplified. In fact, I knew that I could get my dental coverage. I knew I could get my vision coverage. I wear glasses. I knew that if I needed hearing benefits, I had that, the gym membership. And again, I could look at, my expected visits during the year, and I had a really good, kind of snapshot of what was I going to spend on my care. None of it seemed to be overwhelming. So I just felt like that I knew Advantage plans well enough that I was comfortable. And, if I get care for something chronic or something more serious, I'm not likely to travel out of the area. I'm just going to go ahead and try to find the best care I can get where I live?
Right.
I think that's what most people look for.
And that's a good segue into the next pro here. Most of these Advantage plans, they do cover dental, vision, hearing, and prescription drug coverage. Most of them cover all these ancillary benefits, including your prescription drug coverage. And that's a big plus. You don't have to go around shopping for this, that, and the other. It's all there, all in one, ready to go.
Well, on the dental coverage, a lot of people overlook this point, is if you go buy a dental plan, like you say, let's say you have a supplement and you have to go buy a standalone dental plan. Most of them have pretty low max outs for the year, 1,000, 1,200.
And waiting periods.
Yeah. Where on the Advantage plans, some of them have pretty high limits, like mine is 4,000.
That's why.
Now, it's a chronic condition plan. But on the average, $1,500 to $3,000 in dental coverage that you're not paying for. So I think that the thing that's important about that is you're not paying for it, and they have high limits, and they cover just about everything, except maybe implants or some don't include dentures, but they're pretty robust dental plans.
With that being said, we were talking, you just mentioned, what if you had a chronic illness, right? So you come down, God forbid, with cancer or, I have Crohn's disease. That's a very expensive disease to maintain. And people get scared. They're like, man, if I have to take, this infusion, it's 20% of the cost on this plan. And they think they have to pay that all year long. And that's not the case. These days, the max out of pocket, that's the most you would spend for your medical treatments, and that adds in deductibles, co-payments, and co-insurance. They're low. Most of them, I think the average, I could honestly say this, is around $4,000. And that's a lot easier to swallow. When we first got into this business 16 years ago, the max out-of-pockets were $7,000 to $9,000.
Right.
So it come down substantially. So it's not as scary. If you get sick, a little easier to swallow $4,000 than it would be $8,000 to $9,000. There's no underwriting for these plans. So if you wanted to get on a Medicare Advantage plan, there's no health questions that are asked. It's an automatic approval, which is really neat. A lot of these plans do cover a gym membership that's paid in full. There is a network. You do have to stay in the network. However, there's a gym membership that's paid in full. A lot of folks that are getting on the plan for the first time, they go to the gym and they're like, oh my, y'all are going to pay my gym membership? We go look it up, and the gym's in the network, and that's a little bit more savings for them each month to kind of help them stretch their budget. And again, just to revisit this, it's a one insurance card for all benefits. So you go to the gym, you go to the dentist, if your plan has a food allowance on, most of the cards now have the food allowance benefit on the card, or the over-the-counter allowance. Right. That's all on that same card.
That's how mine works.
So it's like on the front's your insurance, on the back is your over-the-counter or your food allowance if you qualify for one of those plans.
Yeah.
Now, that's all the good stuff about the Advantage plans. What's the other side of the coin, the cons? Why would I not want to get one?
Yeah, I don't want to say that this is not the bad stuff. Most people that come to us are coming from, either a group insurance plan, state employment benefits. So they're used to having a network. They're used to having co-pays. They're used to having co-insurance and max out-of-pockets. So it's not a whole departure from what they're used to. But when they get on Medicare, their perception many times is, well, if I got Medicare, would it pay for everything? Well, so some of the things that come up that kind of, if it was a negative point, I would have to say, is many of the services require pre-authorization. Again, if you come from any corporate plan, commercial plan, most of your care had to get pre-authorized, whether it was an MRI, surgeries, physical therapy. So you do have to go through that. You have to jump that hoop and get things pre-authorized. But your physician in their office should be taking care of that. It's not something you have to submit. So I think that, that's kind of one of the things that people don't like the most about it, is it does require pre-authorization, and sometimes it does get denied. But it's not denied because they don't want you to have the service. Many times it's denied because there wasn't enough information.
The wrong paperwork was set in.
The codes weren't right.
Right.
So again, that's part of what we do when we get involved with a client, is when they encounter that, is we call the carrier, we call the
doctor's
providers
office
and say, okay, this is what we got to do to fix this, because they're not in the business to not let you have care you need. They're going to monitor it because that's why it's managed care. Skilled nursing facilities can be the most difficult to get approved. I mean, that's just across the board on any plan that's an Advantage plan. If I get a call about something not being approved, 8 out of 10 times it's going to be skilled nursing.
And when would somebody need skilled nursing? A lot of folks, they don't really know what skilled nursing facilities are.
You know, if you just coming off a surgery and they've kind of completed your care in the hospital, but you're not really ready to go home, you need some more extended rehab, more skilled care, you could be, a prescription written to go to a skilled nursing facility. Again, they're in the business. There's plenty of them, so there's plenty of people going. So it's not like they never authorize it. It's just one of the things that they really toe the line on authorization. So I think if I had one thing that I would kind of hope that they would lighten up on a little bit, would be skilled nursing.
Right.
Higher out-of-pocket costs. Again, if you compare it to coming off not original Medicare, but your group plan, many of those plans, you've got to meet your deductible before it's going to cover an MRI or a surgery. So almost all these Advantage plans have no deductible on the medical side. Now, some of the PPO plans do. They may have a deductible on some of the higher cost care. But on most HMOs, there's not a deductible. So there's some higher out-of-pocket costs that you might experience. Multiple co-payments for a single visit. If you go to your specialist,
right,
and he's $35, then he sends you for an MRI. Well, you're going to pay for that MRI. So again, they get there and they think, well, I already paid my specialist. Why am I paying for this service? Well, because that MRI was not done typically in the doctor's office. They send you to either a clinic within the same facility or outside that. So you might have multiple copays for the same visit. So that does confuse people. I mean, I'll get them. They'll call and say, well, I had to pay twice for this.
Well, it's confusing in the books as well, the materials that we have when we're explaining it to them, because there could be 4 different costs for the same service at 4 different locations. We're all familiar with that, so we kind of guide them on where to go and where not to go.
I mean, it could be an outpatient facility, could be in the doctor's office, could be many things. So you're right, it does change the price depending on where you have that service done. Limited to a network. People worry about that. Now, as we're going to discuss in a little bit about networks, there are some parts of a state, more rural areas, where you may have an issue with networks. But if you're in a major metropolitan area, networks are pretty good. I mean, you can generally find what you need. Now, it may not be the doctor you want to go to in some cases, but I don't know. I find that here in our area, we don't really have that problem. There's a few that are in and out of other networks. So we do have to pay attention to that. When somebody comes in and specifically asks about a plan, first thing we say is, let's check your doctors. Because what we don't want to do is enroll somebody and get a call a month later, hey, I went to my endocrinologist and he's not in the plan you put me in. So that's on us. That's our job, is to make sure that we put them in a plan where all the doctors are covered. Or if it's a doctor that they're like, yeah, I could change, it doesn't matter, I'd really rather have that plan than not have that doctor. So sometimes that is the conversation about how important is that provider to you.
And do these plans, do they stay the same every single year? Have you seen changes year over year with co-payments and cost and things like that? Well,
yeah, the co-pays definitely change. Sometimes they go up, sometimes they go down. I don't see a big swing. We're not talking 100% or 50%. It may go up $10. It may even go down $5, because each year the carriers get to decide how they want their plan to be competitive in the market. So they may choose to lower their specialist copay by $5 and pick up that difference somewhere else. So, again, that's why we review plans with people each year. They should pay attention to their annual notification of changes to make sure that they're aware that they have either a price increase or a price decrease on their plan, so they can, decide if, hey, I'm on the right plan or do I need to look elsewhere. So there is some changes there. And then whenever you look at your benefits, again, those can change. Maybe one year they covered this item and next year they're no longer covering that. But if it's covered under original Medicare, it has to be covered under your Advantage plan. But when you get into things like experimental, things that are not part of original Medicare, that's where you can run into a bit of a jam if you want to get something done.
And earlier you mentioned one of our local plans added a premium of $21 a month. And people were pretty upset about that, right? But if you looked into that plan, they dropped the max out of pocket almost $4,000, and they gave an extra $1,000 in dental, which I think is well worth $21 a month. So it looked bad from the cover of the book, but once you open up, you're like, man, I'll pay $21 a month for that. That's a good change.
Yeah, because I guarantee if you went to that same person and said, hey, if you pay $21 a month, we can double your dental coverage. Most of them would be all over.
In a second.
So, but it's not presented to them that way.
Right.
It's presented to them as, hey, now you have to pay for your plan, whereas you didn't have to pay for it the last 7 years.
That's right.
So I think it's how it's presented to them. So I think you're right, is when we meet with people and they're in a market they have, it's just explain to them, hey, look, yeah, you're paying $21 and this parish or this county is not, but look, they've increased your benefits in these two items, so it does kind of pay back.
Sure,
so it's good there.
I think that's a pretty good wrap on what Medicare Advantage is, the pros, the cons, why somebody would really heavily consider one, and why they would be a little bit more hesitant on why they would not get a Medicare Advantage plan. Now, let's scoot on over to a Medicare Supplement Plan. It's a different animal, but in the same arena there. Why would somebody really consider a supplement plan? What person would that benefit? Well,
when a client comes in and they have that question, what do I do? Which one do I pick? Well, it's not a matter of just this is one we want you to have. Again, we ask those questions about your care. Let's talk about the kind of doctors you see. Let's talk about where do you travel? Where do you live? So I think that when you take all those things into consideration, then it's, sometimes if the conversation leads you to a supplement, it's pretty easy to uncover why this is a better option. Freedom to see any provider that accepts Medicare. So no matter where you go in the U.S., if that provider covers Medicare, that clinic, hospital, then they have to take your supplement that you've purchased to go with that, because it's a supplement to your Medicare. It's going to cover that other 20% minus that Part B deductible. Okay, so I think that having again talked about that predictability and do I have to worry about finding a doctor in network? So if you have a supplement, there is no network. You can go to any doctor.
If I want to go to like the Mayo Clinic and they take Medicare and I've got a supplement plan, I don't have to worry about getting all these out-of-network approvals. I'm good to go. Just call them up. If they take me in, we're good to go.
Right. I mean, being in South Louisiana, MD Anderson has always been a topic of conversation when you get on the cancer.
Always.
Talk. And so if you got a supplement, hands down, they're going to take that. There's only a few Advantage plans that they may take, and they have that prerogative. So again, if somebody says to me, hey, look, I don't care what happens, I want to go to MD Anderson. That's where my relative was cured, and that's where I want to go. So I'll immediately say, well, look, if that is your breaking point and that's your,
I empathize with that. We all have a situation in life where like, man, I don't care. I'm going here. I don't care what it costs.
So I think if that's your hard stop, then the supplement's where to go.
Right.
Fixed out-of-pocket costs. I had somebody at one point said, I want to be able to predict my medical costs for the year within a really tight percentage. I said, well, the best thing would be a supplement, because you can take your premium times 12 plus the Part B deductible. That's what you're going to pay. Now, the unpredictable part is your drug portion.
Right.
Because if you're on a supplement, you have to purchase a standalone drug plan, and those can vary. So I think you got to factor that in. But in terms of fixed out-of-pocket costs, you can definitely dial it into a dime as to what you're going to pay out of pocket.
Right.
And most people are going to meet that $257 if they have anything done annually. No prior authorizations. No prior authorizations most of the time. There are some cases where they may have those, but I find that they're a little bit more lenient. They don't come up as often. I get way fewer calls about, hey, I can't get this service authorized. It's just a fact. So I think, when we look at that, if that's something that really bugs people, we got to bring that up and say, look, less authorizations required. Most of the benefits stay the same each year. I mean, we've been dealing with this for 15 or 16 years, and supplements haven't changed much at all.
No,
Year to year, they stay about
the
the same.
deductible goes up a little bit, but that's a Medicare law deal. It goes up across the board with the way the plan works. What it pays, that stays the same. Would you agree about every single year over year?
Yeah. So usually when somebody calls at open enrollment time, okay, what do I need to do? Anything changed? I'm like, no, it's exactly the same.
Went up $20 or something.
$20. Yeah. So that's all you got to worry about. And they're like, that's it? I'm like, yeah. Because that's when somebody comes in, you can lay out 10 of them, black out the name of the provider, and they couldn't pick it out because they're exactly the same. The only difference I've found is that there is a particular carrier that does provide a gym membership, which is unusual on the supplement market. Most of them do not. So there is one that does. So again, when we do that fact finding, what's important to you, and when they get into, I don't really want an Advantage plan, but I like that gym membership, but I want a supplement, then I know maybe I can kind of move them towards that supplement that has the gym membership, if that's important.
Right.
Okay. So I think we got to listen to what they need. And typically the deductibles are small on year to year. Like I said, $240 last year, $257 this year. Yeah, maybe it's $265 next year. I don't see it going up dramatically each year. Now, the one thing that I do want to point out, if anybody's listening about Medicare supplements, that right now, supplements and Advantage plans are pretty evenly split. I think Advantage plans are almost 52%, whereas supplements are in the 49%. But that has doubled in the last 13 years on the Advantage side. So there's a trend going more towards Advantage. And I think because we're seeing more price increases on the supplements, and I don't see that going backwards. Usually when you start seeing a trend with costs going up,
decreases.
That's where it's going to continue going. And you're going to see 8-10% a year on average. But I know there's been some that were more than that. So my opinion is that over the next 5 years or so, you're going to see a bigger jump on the supplement costs, and that could start driving more people away from that into the Advantage market.
Right.
Yeah. So then, that's all the good stuff about the supplements. And then, of course, there is some things that are not the best part of it. John?
Yeah. So supplement plans, Michael just went over all the pros, why we'd want one of those, who that fits good with. The cons, most do not offer dental, vision, and hearing. Now, some do, very few do. You can get a plan that does offer some ancillary benefits on them, but 95% of the supplement plans do not offer that. And the benefits that they do offer typically are not as rich as what the Medicare Advantage plan offers for the ancillary benefits to dental, vision, and the hearing. These plans are underwritten. So if we don't get a supplement plan in your guaranteed issue period and you want one later on, they can ask you health questions and you can be declined. So that's not a good thing if you want to get one later.
What's the supplement period? What's the guaranteed issue periods?
Okay, so there's different time periods where you can enroll into a supplement plan with no underwriting. The main one is when you make it 65. You've got a 6-month period of getting on a supplement plan with no health questions, no underwriting. And then if you try a Advantage plan for the first time, so you get off of a supplement plan, you try an Advantage plan, you just don't like it for some reason, it's not working for you, you've got a 12-month, they call it a trial right or a free look, where you can go back to that supplement plan with no health questions asked.
Within 1 year?
Within the first year, yes.
Not 1 year and a day?
No, 1 year, you get 12 months. So just keep those time periods in mind. There's some other special periods, but those are the two main ones that we see most.
Or coming off a group?
Yeah, coming off a group, what is it, 60 days, 63 days? So you got a couple months getting off a group where you're guaranteed issue as well. Supplement plans do not offer prescription drug coverage, and most of them have a deductible up to $590. We have found that the standalone prescription drug plans that are paired up with a supplement plan are typically not as rich. They're higher cost than if we went on an all-in-one Medicare Advantage plan. Would you agree with that?
Yeah. Well,
between the deductibles and the co-insurance and the co-pays?
Yeah, I told you I started off on a supplement. And then I started looking at the drug costs because I take a drug that's expensive.
Yeah, you take a high dollar one.
Yeah, and I looked at it, and because on the tiers 3, 4, and 5 plus that deductible, it's more of a percentage. So just my case in point is on my standalone drug plan, I would have spent $1,940.
And what are you going to spend, you think, this year on?
Less than $700.
That's $100 a month savings pretty much.
So I looked at that as one of the factors in switching. So I think that when you're looking at a supplement and you're getting a drug plan, the other thing is to do the analysis that we do with them on their meds and say, okay, if you go with the Advantage Plan, here's what your drug cost is. If you go to supplement, here's your drug cost. That may not be a big enough difference to make up their mind, but it's part of our kind of what we say we do is we look at all the facts and put it in front of you, and you make the choice.
Right. Monthly premiums on a supplement plan, the premiums do increase most of the time every single year. We've seen them increase more than once a year. We've seen them not increase annually, but most of the time you're going to see an increase annually on a supplement plan with attained age, typically is how they do it. Some do community rated, but most are attained age. So when you make 66, your premium goes, you make 67, your premium goes up. We've seen people as high as $500 to $600 a month on a supplement plan. That is just unaffordable, especially if we're on a fixed income, right? We're retired, we're not working anymore, and hey, this is what I get each month. That's it.
Well, usually if I get a call from somebody that's on a supplement and they're saying, hey, I think it's time to explore that Medicare Advantage, most often it's a husband-wife combination. Now they're not only you're paying that high dollar, but they're doubling it. And, if you look at it, and if they're both paying, let's say their all-in cost is $400 each, between the supplement, the drug plan, dental and vision, so that's $800 a month. That's a lot. That's a lot of money. So if you really look at it and kind of map that out over the next 3 to 4 years, you're not likely to max out both of you to max out your plans each year. So then it becomes a kind of a spreadsheet. Okay, which one is going? If it's not a care issue, meaning can I see my doctors in my area?
Let's crunch the numbers.
Then it becomes the numbers.
Right.
And I had one not long ago where a gentleman and his wife said, we can afford it, but we don't want to afford it.
Well, like you made that decision too. You said, let me put the pen to the paper.
I think you got to look at it that way.
Yeah, no doubt. Another disadvantage, and I know this it may not be important to everybody, but having like 5 or 6 insurance cards and having to keep up with all that. Like I was talking earlier, I've actually been taking pictures of my insurance cards. So I have them on my phone because you just misplace things. I don't know where my dental card is all the time. I might have to take it out of my pocket, put it somewhere else. And just having, a prescription drug card, your Medicare card, your supplement card, your dental card, your vision card, your gym membership, all these are separate. And it's just a lot to keep up with. And I know as I get older, and look, I'm only 44 years old, but I'm just trying to simplify my life and make things a little bit easier. And I couldn't imagine, at 65, 70 years old, trying to keep everything in order and keep it a little bit more simple so I don't have as much stress in my life. And that's just another thing to consider. It's just a little bit more simple going the Advantage route as opposed to the supplement route. Yeah.
I think if we do our job that we're called to do when people come in to visit with us, and, we take our time with them, if we look through all their needs and lay it out, it really does. I mean, that's what we're paid to do, is to give them all the facts, not to tell them what we need them to take, because it's not about that. Is we give them the facts and we point out things they may not be picking up on. Say, hey, did you realize that if you do this, that will cause this? So I think that as long as we're doing our work and we're doing it for them, I think we can help people make that decision. They'll be happy with it, and also let them know kind of what's in front of them in terms of if they ever want to make a change. Because, some people feel like, well, I can never make a change. Well, we just tell them, hey, this is when you can change. There's one thing that we didn't talk about, but I'll bring it really quick.
What's that?
Is if you're on a supplement, there's a thing called the birthday rule. Now, the thing about the birthday rule is it's not the same in every state. Some states allow you a one-time switch around your birthday to reprice your plan. So if you've been on your plan for 2, 3, 4 years, it could be that if you re-entered your plan at your current age, it may be a savings on the monthly premium. And it could be if you're in a state that allows you to go to a different carrier, you could take advantage of a carrier that's offering better rates. But I know in the state of Louisiana, where we're based, you cannot switch carriers. You have to stay within the same plan that you're on. You can't go down in your plan, but it does offer some savings. So that's another thing that we tell our clients that get in a supplement. Hey, we should be talking again in 2 or 3 years. Let's look at your rates. And now, if they're perfectly healthy, they can switch anytime with underwriting.
Right.
And they may pass underwriting, because what the insurance companies are looking for is, pre-existing conditions, if you've had back surgery, if you're now diabetic and you weren't before, just things like that. That's when they can turn you down. But if you get somebody that's really healthy, they don't take hardly any medication, everything they have is controlled, there's still an opportunity for them to go through the underwritten route and switch carriers. So, we try to make sure they understand all those parameters so that they understand that there are options down the road. But I think if we do our job, everybody's well informed.
Well, why don't you wrap it up for us here, Michael? I think we did a pretty thorough job comparing the Medicare Advantage Plan to the Medicare Supplement Plan, why we would get an Advantage Plan as opposed to why we would not, and vice versa.
Yeah. The only thing I would say is if you're listening to this episode and you're either turning 65, getting on Medicare, or you're already on Medicare, retiring, and you want to know what your best options are, schedule an appointment with us. Let us go over your options, because a lot of people, we find that we catch them after the fact. They really didn't have all the facts in front of them, and they made a decision, and sometimes it wasn't the right decision.
Right.
Or they did it through a service out of their area. They really required a one-on-one type encounter. So if you would like to have a session with us in terms of looking at your options, give us a call at 225-408-4100 and let us know that you'd like to set up an appointment. We'd be glad to sit down with you and just kind of review your options.
Awesome.
Hope you enjoyed our discussion today on Plus 65 Digital. Reach out to us at info@plus65advisors.com or give us a call at 225-408-4100. Make Plus 65 Advisors part of your Medicare process.